Psychosis versus neurosis. So what is the main component which differentiate the psychosis versus neurosis? If the insight is absent, very important MCQ, it is known as psychosis. If the insight is present, that is called as neurosis. What is mean by insight? Insight means awareness. That is the person's once he is aware, the person is aware about his disease. So in the case of a neurosis, the person thinks and the person knows that something is wrong with his behavior, he have to correct it. In the case of psychosis, the person do not have any sort of awareness or understanding the disease. He simply thinks that he is normal, but the patient will be abnormal. So that sort of condition is known as psychosis. And if the patient knows something that something is happening with them, that is known as neurosis. Okay, next. In the case of a judgment and reality, the patient do not have any reality and patient cannot able to make judgments. No reality, no judgments. Here, reality will be there and here judgment will be there. Reality and judgment both will be there. Okay, next. If the patient loses reality, the patient talks to himself. So there is a positive hallucination and delusions. Positive hallucinations and delusion. What is meant by hallucination? That is, without a stimulus, the patient's perception occurs. Without a stimulus, the patient perception occurs. That is, the object won't be present, but the patient thinks like the object is present. That is known as hallucination. So hallucination and delusions will be present. Here there won't be any hallucination or a delusion. Hallucination and there is no delusion. In the case of psychosis, the patient's personality will be impaired. Patient personality will be impaired. In the case of delusion, neurosis, patient personality will be preserved. What are the examples of your psychosis? Mania, and schizophrenia. Or the psychotic disorders. In the case of neurotic disorders like OCD, post-traumatic stress disorder PTSD, generalized anxiety disorder GAD, panic disorder, and so on. These are the difference between psychosis and neurosis. Very important, you should know. So it lacks insight and it has insight. Okay, so these are the important one. And what are the important days you need to remember in psychiatry? So